Good morning and welcome everyone to the Older Americans Month webinar. We are so excited to be with you today. My name's Allison Burnell and I am your first speaker of the day. We will also have Amanda Johnson and Dr. Timmy Tope Walker today joining me to talk about Older Americans Month and the services and supports that the Division of Aging offers in support of the Department of Human Services. Just a quick housekeeping note. If you have any questions, you can always type them into the Q&A up at the top of your screen, and we will answer those questions at the end of this webinar. Or you can wait until the end of the webinar and ask your question. So with that being said, I will kick us off. Next slide, please. Okay, so I just always like to start with our vision statement for the Department of Human Services, which is Stronger Families for a Stronger Georgia. We at the Division of Aging Services support stronger families by empowering older adults and their caregivers and those with disabilities to live safely, live long, and live well. Next slide. So the first thing that I'm going to talk about today is my section within the Division of Aging Services, and that's called Livable Communities. We offer programs and services to older adults, caregivers, and those with disabilities, and that's under the umbrella of home and community-based services. Our goal is to keep people living independently in the setting of their choosing for as long as possible. Next slide. One of the biggest services that we offer through the division is nutrition services. And you may have heard the term Meals on Wheels before. In our division, we call it home delivered meals. And we also do congregate meals, which typically occur in a senior center. And we have 3 goals for the nutrition program. It's not just about providing food. It's more than a meal. So the first goal is to prevent malnutrition. We want to make sure that not only are our clients not going hungry, but also that they're getting the proper nutrition that they need on a day-to-day basis. We also want to promote socialization. And the reason for that is because the research shows that when people eat together, they tend to eat better and eat more. So that's one of our big goals, is to promote socialization. And then also, lastly, is to offer nutrition, education, and counseling. So with our meals monthly, our meals clients receive nutrition education. It might be an in-person nutrition session. It might be a flyer or a handout, something like that, but that is provided monthly. Also, around the state, our area agencies on aging are contracted with dietitians who can provide nutrition counseling. What a dietitian does in a nutrition counseling session is first do a comprehensive nutrition assessment and then help you to set goals, nutrition goals, health goals, life goals, things like that. So again, we have our home delivered meals program, our congregate meals program, and our nutrition education and counseling that's all wrapped up under the umbrella of nutrition services. Next slide, please. This kind of goes hand in hand with nutrition services. This is evidence-based programs. So this is not a service like a meal. It's a program. It's a class. It's a course. And the reason why they're called evidence-based is because they have been proven through research to work time and time again. These programs can be replicated and similar results are expected to be seen. We do have a website for all of our evidence-based programs, and you can see it here on the slide. It's called georgiahealthmatters.org. I would encourage you all to go to the website where you can see all of the evidence-based programs that we offer, where in the state they're happening, and if they're happening in person or virtually. Just to give a quick rundown of the evidence-based programs that we offer, we have one of our biggest and most popular programs is the Chronic Disease Self-Management Program. We also have the Diabetes Self-Management Program. We have health coaches for hypertension control, a Matter of Balance, which is a falls prevention class, Tai Chi for arthritis and falls prevention, Bingo Size, Powerful Tools for Caregivers, Vivo, an exercise class, Map Habit for people living with Alzheimer's and their caregivers, just so many programs that promote health, help to prevent disease, manage disease, and also offer that socialization piece that we were talking about on the previous slide. Okay, next. Okay, so if you know someone who has some complex needs, maybe they need a lot of help, or maybe they're at really high risk of having to go to a nursing home, one of the services that we offer is called case management. Case managers are all around the state. They are provided throughout our 12 area agencies on aging. And case managers will take on those more complicated cases or those people who are at imminent risk of having to go to a nursing home, and they will do a comprehensive assessment on that client. They will also help the client to map out a service plan. And the reason why on the slide it says person-centered service plans is because the case manager is not there to determine what you need. The case manager is there to work with you to get you what you want and what you need to have a high quality life. And then the case manager provides that linkage to community resources. So it might be some of our programs and services that we offer at the Division of Aging, but it might be, programs and services through a faith-based organization, or maybe a food pantry or something like that. That case manager knows all the resources in their area and can help provide those linkages to those resources. Just another note, excuse me, we also at the division collaborate with transportation services and the Department of Behavioral Health and Developmental Disabilities. And what we're really trying to do in working with both of those sections is to increase access. So we want to make sure that our older adults and those with disabilities have access to transportation and mental health services. So although we don't offer those programs directly, we do keep in close communication with transportation and DBHDD to make sure that our clients are not forgotten about and that aging is represented when those conversations are happening. Next slide. Okay, caregiver and kinship services. So a lot of times when people call the Division of Aging Services looking for services, they're thinking about a person who is a client. But we also know that there are many, many, many unpaid caregivers out there in Georgia. We call those family caregivers or unpaid caregivers. And we also have services to help support them in their caregiving role. So what we're trying to do is reduce the caregiver burden because we want our caregivers to continue to give care to the family member or who we call the care receiver and delay costly institutional care. So the service that caregivers can get is called respite. And respite may include things like adult daycare, homemaker tasks, personal care tasks, home delivered meals, or other supportive services, just depending on what the caregiver needs to reduce their burden. We also offer evidence-based programs that are specific to caregivers. And this might be something like dealing with dementia, care consultations, powerful tools for caregivers, anything that can help support them in their caregiving role. And then we also have kinship care, and you may or may not have heard the term kinship care. A lot of times it's referred to as grandparents raising grandchildren. You may have heard that term before. But kinship care includes grandparents or relatives who are caring for children. And services that kinship care people can get is support groups where people can come together and learn from each other. Material aid. Material aid includes things like backpacks for kids, summer camps, things like that. We also do a good bit of community and public education and special events for kinship caregivers so that, again, they can continue caring for those children. Okay, next slide. Okay, the Senior Community Service Employment Program is a kind of a unique program at the Division of Aging Services. First of all, the eligibility is a little bit different. For most of our Division of Aging Services and programs, you have to be 60 or over to be eligible. But for the CSEP program, you have to be 55 or older. You also do need to be low income and have poor employment prospects. And if it's determined that you are eligible for the CSEP program, then you are placed into what's called a host agency. And a host agency is usually a community services agency, a nonprofit, something like that. And the participant is paid while they are training. So they're learning new skills, they're gaining experience, they're building their self-confidence, and the host agency also receives a temporary supplement. So it's really a win-win. The participant in the CSEP program gets the training that they need to hopefully move on to unsubsidized employment, and the host agency receives a supplement which helps them in their business. Also, host agencies get access to workers with really high work ethics, and I want to emphasize that. People who come into the CSEP program really want to work. They want a job. They just need training and skills. So it's a win-win for the participant and the host agency. Next slide. Okay, the Senior Hunger Initiative. Years ago, we wrote in our state plan, we have a state plan on aging. And years ago, we wrote into our state plan that we wanted to focus on senior hunger. And we got so much support and so much interest in this that we ended up writing a state plan on senior hunger. We also ended up hiring a senior hunger nutrition coordinator who you'll hear from a little bit later in this presentation, but we do have a website and you can see it there, aging.georgia.gov. And if you just look for Get Involved /Senior Hunger, You can find where senior hunger events are happening in your area. You can find out about your regional senior hunger coalition, which is a networking group of agencies and individuals who are committed to ending senior hunger in Georgia. The state plan really maps out how we want to tackle this problem, how we want to raise awareness, and how we want to seek solutions for senior hunger in Georgia. So we research and report on resources. We look at gaps in service delivery. We look at innovations and strategy development in ending senior hunger, and also support initiatives in the state and also in the nation that further the goals of addressing senior hunger in Georgia. Next slide. Okay, in-home services. This is probably the bulk of the services that we offer through the Division of Aging. And again, like I stated earlier, to qualify or to be eligible for these programs, you do need to be 60 years of age or over. You need to have a physical or mental disability, which restricts your ability to perform activities of daily living, and have little to no support. So we do place a special emphasis on people who are in rural areas, people who are in the greatest economic or social need, and those with severe disabilities. But some of the services we offer are things like homemaker services, which could be assistance with preparing meals, doing shopping, managing money, or light housework. We also offer personal care services, which could be assistance with eating or dressing, bathing, grooming, toileting, and transferring. Also chore services, which is assistance with heavy yard work or heavy housework. Home modifications and home repair services. So we can actually go into a client's home and make some modifications, things like adding grab bars in a bathroom, or maybe installing a wheelchair ramp to the outside of the home, anything that promotes the safety and well-being so that a person can stay in their home. And then we also have assistive technology. If you've never heard the term assistive technology, that's okay. Assistive technology is really just a device or a tool that allows a person to live and function independently. So some examples of assistive technology. We have some low-tech assistive technology, which might be something like a sponge on a stick so that a person can reach their feet or reach their back, right? It might be something high-tech like a Google Assistant or an Alexa, something like that, that helps them to remember to take their medication or things like that. There are assistive technology labs all around the state. They are at each area agency on aging, each center for independent living, and there's also a nice big one at Georgia Tech. And you can go and try out some of the pieces of assistive technology before you buy them or before they are provided to you to figure out what's going to work best for you. So, yeah, assistive technology is something that we have been really really promoting for the last probably 5 to 6 years because people really want to live independently, and assistive technology is something that can help them do that. Next slide. Okay, social isolation and loneliness. This really bubbled up as a needed service during the pandemic. If you have not ever heard before the health effects of social isolation and loneliness are the equivalent of smoking 15 cigarettes a day. So it is just as bad for your health as smoking is. Being socially isolated, being lonely, it's a health risk. It can make chronic diseases worse. It can bring on chronic disease. It's just something that we knew we needed to address. So we brought on two experts in the field of social isolation and loneliness, and we have two targeted programs that we're looking at right now to address this issue. The first one is called Telephone Reassurance, and this is a phone call that's made to a person to help reduce their social isolation. It's just a check-in, but they provide support and ensure health and safety. And then we also have Friendly Visiting, which is exactly what it sounds like, visiting a person where they reside to help reduce social isolation and feelings of loneliness. We do have two assessments. We have two assessments that we do for social isolation and loneliness. So if a person reports that they live alone, we will screen them for social isolation and loneliness, and then again, connect them to resources in their area. Next slide. Okay, so that's all of the programs and services that we offer. And I just really want to put a pin in this slide that if you need, or if you know someone who needs some of those services, please take down this phone number. It is 1-866-55-AGING. That's 1-866-552-4464. That is your single point of entry. We call it our no wrong door to our programs and services. So when you call that number, it will connect you to the right area agency on aging that can provide those programs and services for you or your loved one. Next slide. Okay, before I turn it over to Amanda Johnson, I just want to wrap up by saying that, again, my name is Allison Burnell. I am the section manager for Livable Communities. You can see my email on the screen, and also if you'll just glance to the right, you will see a map of our 12 area agencies on aging and all of the counties that they serve. So if you are in the metro area, then the Atlanta Regional Commission is your area agency on aging. But for those of you in other parts of the state who might be on the webinar today, you can look around and see which area agency on aging represents you. I thank you so much for your time. I really appreciate your interest in Older Americans Month, and hopefully gave you some good information that you can use for yourself or for a loved one. And with that, I will turn it over to Amanda Johnson.
Thank you, Allison. Good morning. My name is Amanda Johnson. I am the Aging and Disability Resource Specialist with the Division of Aging Services. I'll be sharing with you all how to connect with the programs and services like Allison has described, and resources as well. Next slide. So the Aging and Disability Resource Connection is part of what's called the Georgia No Wrong Door System of Care. No Wrong Door system empowers individuals to make informed decisions, to exercise control over their long-term care needs so they can achieve their personal goals and preferences. A No Wrong Door system provides a coordinated way for people to access services in the community so that you only have to tell your story one time. Through a network of agencies, No Wrong Door expands access to services and supports and helps individuals and their caregivers navigate resources that they need with a person-centered approach. Next slide. So within the ADRC, or the Aging and Disability Resource Connection, we provide several services to callers or individuals who are referred. That's going to include the initial information, referrals, and assessments for long-term care services and supports, connection with our statewide resource database, which is known as EmpowerLine Pro or ePro, and unbiased referrals to both public and private resources. Additionally, the ADRC counselors will complete assessments for eligibility, and that's for both older Americans Act programs that are funded by non-Medicaid dollars and the Elderly and Disabled Waiver Program that's funded by Medicaid dollars. Within the ADRC, we have options counseling as well, and that's both community and MDSQ options counseling, and it's provided to assist individuals who may be in the community or within a long-term care setting with making decisions regarding their care. And also we have our community transitions programs, which are known as Money Follows the Person and nursing home transitions, which assist individuals who are in a long-term care setting return to living in the community. Next slide. So how can you connect with the ADRC? You can always use the 1-866-552-4464 number, and the ADRC is option 2. Or on the DHS website, you can find a map similar to the one shown on the screen that can connect you with the AAA that services the person's county which they reside, or through our georgiaadrc.com website. Next slide. Here is a screen capture of the georgiaadrc.com homepage, and under it has several resources, and also under the Assess My Needs tab, you can fill out a brief online assessment that will gather demographic information and information regarding possible needs. And once that is complete, it goes directly to your local AAA, and an ADRC counselor will reach out to further assist. Next slide. How can you collaborate with the ADRC team to assist in DHS vision of stronger families for a stronger Georgia? As a member of our network, which includes DAS staff, AAA staff, and others from senior centers and all of our collaborating partners, each of us plays a role in helping to spread awareness about the role of the ADRC and how it can support individuals and families in navigating our system of care. The No Wrong Door system is here to empower individuals to make informed decisions, to exercise control over their long-term care needs, and to achieve their personal goals and preferences through our agencies, expanding access to services and supports, helping individuals and their caregivers navigate resources they need with a person-centered approach. It's the responsibility of the ADRC to provide unbiased, reliable information and options counseling to anyone seeking information on long-term services and support, regardless of age, income, or disability. The keyword to remember is access. Next slide. Here is my contact information. If I can help support or answer any questions, feel free to reach out. And now I'm going to hand over to Dr. Walker with the Senior Hunger Initiative. Thank you all.
All right, good morning, everyone. I want to talk to you about how we leverage all the great services that you had an opportunity to just hear about that falls under the Older Americans Act. So follow along with me. We're going to essentially look at what our access points are and how you as individuals, supporters of older adults or older adults yourself can best utilize all of these great programs and services that are offered. So let's go to the next slide. So the first thing I want you to do is to think about all of your access points. And that really starts with understanding that when we talk about the Older Americans Act, which is the federal policy that allows us to offer these great programs and services, that we take that information at the federal level, and as the Division of Aging Services, as a state unit on aging, we take that funding as well as that policy information and help to disseminate the funding and monitor the area agencies on aging at the regional level. And then from there, just in your local areas, there are senior centers across the state where older adults and folks really of all ages, depending on what activities are available, have an opportunity to get access to these services, engage with one another. And then when we think about broader access points, it's really about recognizing that here in the state of Georgia, with our 159 counties, that every point of contact where you're engaging with other people presents an opportunity where leveraging information, technologies, access to programs and services can happen. Some of our area agencies on aging are also regional commissions, so that really opens up the avenue to connect with other supportive services when we talk about transportation and really thinking about what regional planning looks like in a full community. We have over 200 senior centers that receive these federal funding dollars ultimately. And then it's really connection to Centers for Independent Living, as well as memory assessment clinics and many university partnerships to really give a full picture. And really, maybe I'll even correct that and say that not necessarily a full picture. There's even, when we think about access points, it's really just recognizing that even libraries and other sources like that all together make the points at which we can get access to these great services and certainly information about them. Next slide, please. So in leveraging access to programs and services, I'm going to break down this into 3 simple points. And that's going to be about the importance of educating yourself, taking action, and getting help. So the first thing, when we talk about educating ourselves, we've got to know where the older adults are that live in the communities where you are. And that may be yourself or family, friends, people you see around, to really have a connection with that. And then from there, what are the resources, programs, and services? Of course, we've done a bit of a deep dive into some of the Older Americans Act services, but the realization is that when we're talking about older adults, it's not only those services, but the wraparound services that provide the most supports for our older adults. And we've got to see that full picture. And then in thinking about that, older adults, there are some older adults who have a greater need than others. And being able to identify, okay, who are the older adults who are living alone, who may not have family and friends to check in on them, and just being in tune to that. And the last thing is, once we've taken in that information, really, how do we connect? And so you're in the right place today, being a part of this webinar and thinking about getting information and being able to disseminate that back out. Next slide, please. So going from educating yourself, and the next step is taking action. So what does that mean? That actually means participating in the programs and services that are offered if you qualify. And that includes the people who you might engage with, who might be also people who could participate in those programs and services. You want to share what you've learned and what others have learned about these programs and how they impact you, because we've realized that nothing beats that one-on-one, I know this person, this is what they're telling me, to really have the best impact in being able to get seniors to engage in these programs and services because they know someone who's engaged in those. And then in identifying, yourself as well as others, what is needed, that's an opportunity to see, okay, what are the local stakeholders? Of course, we at the State Unit on Aging look at the whole state en masse, but there are local stakeholders. As you know, some of you may be on or maybe listening to this webinar today, and really trying to be in tune with sharing what the needs are, because that does change depending on where you are. And then in thinking about all of that, how do we then engage with older adults who are in need and helping them to take action? Next slide, please. So from there, it's like, okay, now that you know that they're older adults or you yourself need these services, how do you do that? Of course, you've seen this number already, but I cannot stress it enough how amazing the Aging and Disability Resource Connection can be to help identify resources, services, and even senior centers that are available to you. They are, of course, available online, and the number is there. Option 2, always remember that. And even Allison has shared that in making your connection to where your local area agency on aging, you got to see the great graphic of where the different AAAs are located. You can go online and get specifics, which counties and which area agency on aging is in where you are. So then the other part of this is I just stressed about the importance of looking at wraparound services, and some of those include SNAP, Medicaid, and utility assistance. And so we always want to give that plug for some of the other programs that are offered in our Department of Human Services, and that's through the Division of Family and Children Services. And you can go online to gateway.ga.gov/access to see some of these other great programs that have been critical support for many of our older adults. All right, so next slide. So I want to take this opportunity that for those of you who are in the category of being experts, policymakers, community stakeholders in helping to gain greater access, encourage healthy aging, this is the conference for you. We are going to be celebrating 25 years of excellence in aging. This is the first conference we've had in person since 2019. And in doing so, June 3rd through the 5th, this conference will be sharing best practices, professional development, as well as an opportunity to network with other aging professionals. We'll also include sessions about the Senior Hunger Initiative, for which you see that entitled That's My Connection, but you get more details there. The cost of the conference to the registration is $350 per person, and that includes meals as well as the registration. If you're interested in participating in this conference, you have a QR code on your screen there. Of course, you can always go to aging.georgia.gov and search Healthy Aging Conference, and it'll come right up. Okay, so please, if that is of interest to you, we'd love to see you there. All right, so if you will go to the next slide for me. What I want to do, of course, there are many other opportunities where I go and do a deep dive on senior hunger, but I just want to in the slide that has my information, is just to give a plug that we're always looking for ways to highlight, to address, to see what's happening across the state to end senior hunger in Georgia. And of course, in social media realm, we always put hashtag End Senior Hunger Georgia as an opportunity to spotlight some of the things that are taking place, initiatives that we have. Just last month was Senior Hunger Awareness Month, and we highlighted different programs and services that are offered. And I just leave it in this one slide to say, if there's ever an opportunity or something you want to highlight, I would welcome you to reach out to me to share about those great things or things that you want us to take a look at in this space. This is the platform and opportunity to do so, and we thank you for that. So if we go to the next slide here. In this Older Americans Month, there's one more hashtag. So the theme for this month is Powered by Connection. And so you have an opportunity to actually meet that theme and being present to engage in this webinar today. And we, of course, encourage you to reach out to us and also reach out to your local area agency on aging to see what services are offered. And I do want to take this opportunity, if you have any questions, either for Allison Bernal or Amanda Johnson or myself, this is a great opportunity for you to do so. We have a Q&A available for you to ask any questions, and we are here to do so. And with that, we thank you for that, and we'll just take a moment and see what questions may drop into our Q&A.
Thank you, Dr. Walker. We don't have any questions yet, so we do encourage people to type in their questions. There's no question too big or too small. We can always get you an ADRC counselor to talk to you if it's not something we can answer right here. So just type that into the Q&A section.
Thank you for that, Jennifer. I do want to take this opportunity as people are pondering potentially to ask a question to say that we will put this recording of this webinar on our website as well. All right. Well, we have our information there on the screen. If you have any questions, we welcome you to shoot us an email. We'd love to hear from you. We thank you for your time this morning, and we'll give you the rest of this time back in your day. Thanks a lot for joining us for the Older Americans Month webinar, and have a great rest of your day.